Friends, we are discussing today about the BTB graft for ACL surgery. BTB graft is a bone patellar tendon bone graft. It is called as a gold standard graft for ACL procedures and ACL surgeries. So it is a question in your mind that why it is the gold standard, what are the advantages of it, what are the disadvantages of it. So in this video, I will be covering about all the details pertaining to the BTB graft, the advantages, the disadvantages, the patients in which this graft should be used, and what are the limitations and in which patients you should use this as a preference. So be with us till the end in this video. You must know that ACL ligament is a ligament which takes a lot of load, stretched into a lot of positions when the knee is working, flexing, extending. So there is a chance of late laxity in whatever graft that we implant. So what it means is what the graft we implant at this point of time, let's say after 5 years or 7 years or 10 years of time, the graft will be little stretched into its position, and that may cause a late laxity, or that may cause what is called as a loose knee after some time. You would be happy to know that this late laxity is minimum in the cases of BTB graft. BTB graft is a bone patellar tendon graft. It is harvested from the middle anterior aspect of the knee. It has bone plugs on both the sides, one from the patella and one from the tibia, and the tendon in between. The tendon is usually harvested about 9 millimeters to 10 millimeters in width, which is a proper size for the ACL graft. Also, this graft entails a bone to bone union on both the sides, the femur and the tibia, and thereby the strength of fixation of this graft is much better than the traditional soft tissue grafts. You can mobilize the patient early. The patient can be made to walk very quickly, and once the bone to bone union occurs, the patients can be encouraged to play sporting activities as well. A very important advantage of using BTB graft is you don't have to use fiber tape like constructs, because the graft itself is rigid and it does not have a creep, it will not elongate over time. So you don't need to use a fiber tape if you are using a BTB graft particular position in the right anatomical position. Now this graft is essentially a very good graft if you are treating obese patients, patients with high BMI, sports person, the patients with high demands, laborers, and typically it is very useful in revision scenario where one of the ACL ligament has been reconstructed prior, but the patient has a re-injury or failure due to any reason, and now the patient has a laxity. So in the revision scenario, this is a very good graft because there will be tunnel widening, and we need a good bone to bone healing in these revision scenarios. So if you talk to me in any revision case of an ACL, I would recommend BTB graft as my first preference graft, owing to a very good solid union. You can do it in widened tunnels. It will be a good bone to bone healing, and there are very less chances of late laxity. So it is the preferred graft for me in case of any revision ACL scenarios. Now BTB graft can be fixed with many fixation devices. You can use interference screws, which can be titanium or biocomposite. You can use buttons which are adjustable, or you can use as a press fit fixation on femur, which is also called as a chamber technique, which is one of my favorite techniques to treat revision ACL scenarios. So chamber technique is a press fit technique in which you can use a BTB graft without any fixation device. So that is an added advantage of using a BTB graft. So by and large, it is a very good graft as far as the strength, the longevity, and the time to union of the graft, but it does have some shortcomings. So what are they? BTB graft is usually harvested using one incision or two incision. but usually the size of incision is little more than the traditional grafts like hamstrings or peroneus. BTB graft has higher incidence of anterior knee pain because when the patient sits on a kneeling down position, the knee will fall onto the scar and you may have a higher incidence of anterior knee pain after a BTB surgery. The paresthesias on the anterolateral aspect of the knee is also higher if you are using a BTB graft. So, all in all, this is a very good graft and it is one of my preferred graft specifically to be used in selected scenarios, specifically revision. So friends, if you have any more questions pertaining to the BTB graft, you can message us on the comment box or you can write on to the number given below for details. Thanks a lot.